Hello and welcome to Mastering 5x5 Stations. I'm Katelyn Proctor. As many of you have been here before, you know who I am, but a little bit more about myself. I am a Canadian trained physiotherapist. I did my master's in physical therapy at UBC. I have two roles. My one role is I work in private practice in orthopedics. And of course, my other main role of my life is I do all the content creation for PT Exam Prep. I'm the founder of PT Exam Prep, and am very, very dedicated to helping students pass this difficult exam. So one of the things that I wanted to talk to you guys about are these 5x5 minute stations. Now they trip a lot of people up. I constantly am getting having conversations with students after the exam, and they're saying that those 5x5s were the ones that really were tricky, and they were harder to figure out what they were looking for in such a short amount of time, and especially the written part of it. A lot of people are very focused on clinically practicing their skills, and they miss that theory component. So today I'm going to go over as much great information as I possibly can in 45 minutes. So as always, before I start, I do want to know who's joining me today. So I'm going to post a few polls on your screen if you can help me and answer them as quick as possible. So I'm expecting to see a lot of you guys do November, but of course I know that there are a few exams coming up next year, right? June and November. So let's just see who is here with us. To give you guys a bit of an idea of how many people we have today, we have just over 300 of you joining us. So there's a lot of you. Okay, so I'm going to close that poll. So it looks like for the most part, the majority of you are doing November, and then some are doing June. All right. Let's keep going then. I'd like to know, where did you complete your physiotherapy program? I kind of want to know who I'm talking to today. As I said, I did it in Canada. I understand that I did not include everywhere, but the Alliance puts out a report from where the most people do come from. So I've included those there. I know that the next kind of big cities big countries, source countries are the US. But let's just see what we're dealing with here. Good, okay, about 5 more seconds, put your answers in. So as a heads up too, I can't see what your guys' responses are, but I can see when you guys write questions. So if you want to be anonymous, this is the time to be. Okay, so let's take a look. It looks like about almost half of you are from India, and then we have a ton more that are from Canada, United Kingdom, a few less, and Australia. Okay, interesting. So the majority of our students, we do have a lot from India, but we do have a lot from the United Kingdom or Ireland and Australia, so I'm surprised to see a lower amount there. Let's go. Are you currently enrolled in a course? I'd love to know if any of you guys are with us. I see a lot of you guys. Hi, Duty. Hi, Samina. Nice to see you guys here. Karne. Okay, let's see. Now, I put a little sneaky one in there. No, I'm confident I will pass without taking a course. I'm excited to see how many of you guys actually click that one. Okay, 10 more seconds here. Awesome. Okay, closing that. So actually, the majority of you guys have taken the full course with us, which I love to see, especially because this is a bell-curved exam, meaning you only do as good, or how can I put that? You're scored against your peers. So to see so many of you that have taken a course, that's really, really exciting. Okay. Hide those results. And then last, this is a little bit of knowledge for me. So I'm going to give you guys a bunch of knowledge. I want you to give me a little bit of knowledge back. So we do our courses with one session a week for 10 weeks. We played around last time with doing 2 sessions for 5 weeks, and we've also considered doing condensed weekend courses. So what I'd love to get from you guys is, if you were taking a practical course, what would you rather? Would you rather do 1 a week for 10 weeks, or rather 2 a week for 5 weeks, or would you rather do condensed over the weekend? Oh my goodness. This is why I can never make decisions. You guys are pretty much split a third, a third, a third right now. Let's see. So about 70% of you have voted. We'll get 5 more seconds and let the rest of you vote. All right, I'm going to close it. So this is why it's hard to make any decisions. I'm going to share those results with you guys so you can see how funny this is. So, I mean, the majority of you are saying 1 session a week for 10 weeks. There are some of you that like the condensed, and there are some of you that like the weekend. So that just goes to show you can't please everyone, right? All right, but hopefully I can please all of you guys today with this material. So let's close this and get going. So the last thing I want to ask you guys today is, what's one topic you wish you knew more about? So your exam for most of you is coming up this weekend. What's something that you wish that you knew more about before your exam? So please type it in the chat box for me. So pediatrics, MSK, let's be more specific. How much to verbalize in stations, goniometry, neuro. You guys are being very vague. Give me like really specific topics like postural drainage positioning or ABGs, mass, manual muscle testing, cardiac surgeries. Okay, getting lots. Thank you guys. So I'm going to save all those, and those are going to help me when I'm trying to get together some new information to teach you guys. So awesome. For all of you who did MSK, I really hope that you know a lot about that, because that's going to be about 50% of your exam. All right, let's start. So what are 5 by 5 minute stations? So in these stations, you are going to have a 5-minute interaction followed by a 5-minute written response. Okay, you're going to have 16 stations in your exam, and half of them, or 8 of them, will be 5 by 5 minute stations. You will have your written responses marked after the exam at a centralized location where the markers use an answer sheet and guidelines to mark your answers. So the written station is worth 50% of the total score for each of your 5-minute couplet station. All right. So this is important, and I'll chat up to this a little bit later, but the reason why this is important is because a poor performance on either part of the exam can save you from failing. So a poor practical can help you, or a good job on the practical can save you from a poor written, and vice versa. So don't let a poor practical performance follow you into that written section of the exam, okay? So next, what is in that 5-minute clinical interaction? So you only have 5 minutes, so you need to be efficient and perform the task that's being asked of you. So don't try to do too much. The keys of this are the questions are typically to the point. They're asking you for 1 or 2 clinical interactions, and even sometimes the stations will say what they don't want you to do. Okay, so make sure you focus on the question and only do what the task is asking. You're going to feel rushed on these stations, okay, guys? Hear it from me, you are going to feel rushed. So it's important to constantly remind yourself to speak slowly, something I need to do in these webinars. But you're not the only one who's going to be tired and burnt out. That examiner is as well. They have listened to people do the same station over and over and over again all day, especially if you're in that afternoon cohort. So make their job as easy as possible by speaking slowly and clearly, okay? So this brings me to my main point in this clinical interaction is be organized, okay? Now I know this isn't the first time that you've heard this, but if there is one thing you take away from any of our courses at PT Exam Prep or today's webinar, it's that you need to have an organized approach. Okay, stations are fairly easily put into frameworks or templates of how to properly do them, and that's what we try to teach you to do, okay? We want you to tackle these questions in such an organized way that when you're answering them, it's fairly easy. There's a good flow. You're not making the patient get up, get down. You're not setting things up halfway through the station. You want to be organized. So organization truly is what's going to set you apart from other students. Really, really important. Okay, so sorry, I'm going to go back about the organized portion. I'm going to tell you that when I took my exam, I would first read the question, organize my thoughts, and when I felt ready, I would close my eyes and imagine myself doing what I had planned. Okay, so you can picture nerdy me standing in front of that piece of paper. I would, write down what I wanted to do, or sometimes I would just think through, but I would always take at least 20 seconds and I would close my eyes. So once I heard the buzzer to the station, it was game time. I knew that I'd already kind of practiced it really quickly in my head. So in my mind, it was really the second time I was doing the station. okay? I found that when I was practicing, this was a really, really good technique to help me. And of course, when I went and did my exam, I feel like it was one of those major points that helped me pass. So the other thing, and I was just kind of talking about this, is please don't let your performance on your past station follow you. There are 16 stations on the exam, and you are allowed to content fail stations, okay? You really are allowed to content fail stations. The number of content fails really does depend on your cohort though. So say for example, 3 to 4 stations usually are the ones that, for each exam, there's usually at least 3 to 4 stations you're allowed to fail in order to still go on and pass the exam. Okay, so keep that in mind. If you had a bad station, you feel like you've done just a crappy job, that's okay. Shrug it off, you're allowed to fail. Now, the caveat to that is you are not allowed to safety fail or have a major incident, okay? That is an automatic fail. So still don't carry those forward with you. Obviously, everyone's goal is to not safety fail, but do know that if you totally bomb a station, that's okay, okay? Pick your socks up, move on. Let's talk about those written interaction stations. So there's a few points for this that I really want to drive home to you guys, and that's write neatly and stay inside the marked area, okay? For those of you who are taking your exam in 2019, I highly suggest keeping up with your theory information. I often encourage students to take their written exam and practical exam really close to each other, so you don't have to spend time relearning or rememorizing that theory material. A little aside, but when you are doing those 5-minute interaction stations, you really want to make sure that they are not struggling to read what you're writing. Again, I know you're stressed. I know that time feels like it's slipping through your fingertips, but really make sure that you take the time to just write clearly. Do not write outside of the marked areas. They will not mark anything outside those areas, okay? Next, if the question asks for 3 responses, they will only mark the first 3 responses. So if you have 6 ideas, pick your best 3 and only write those 3 down, okay? Again, they will only mark your first 3 responses, so please do not write more than that. I feel like I could say that point 10 times and it still wouldn't be enough times to say it. I really hope you guys take this from me. Please only write down the amount of answers that they ask for, okay? If you do not like your answer, erase it or cross it out. Don't scribble or try to write over it. It only makes it harder to read. Erase it, cross it out, move on, okay? Last little point, because I know we do have quite a few Canadian students here. In Ottawa only, you can write your answers in English or French. Everywhere else, your answers will only be marked in English. This seems like a simple point, but I just want to remind you of this, okay? You can get more information language choices in the registration guide, but for all of you who are here right now and you're not writing in Ottawa, if you're not writing in Ottawa, please only write in English, okay? Next, getting into more of the fun stuff here. So abbreviations and acronyms. So the Alliance's stance on abbreviations and acronyms is that you can use common abbreviations and acronyms. However, if you are unsure about whether an abbreviation or acronym commonly understood, write it in full to make sure that the examiner who marks your answers will understand what you mean, okay? Now, PT Exam Prep stance on this is that we advise all of our students to avoid abbreviations or acronyms. What may be common to you may not be common to the marker, so if you have time, please just write it out, okay? You know, I struggle with this one because there's some like ROM, range of motion. They're gonna know, right? But say, for example, Parkinson's disease, PD, not as acceptable. Some people, they've had experience in neuro and that's super, common. But I really do suggest that you just stay away from abbreviations or acronyms, okay? Next, I want all of you guys to number your answers, okay? Everyone, look at me right now, hold your right hand up and say, I do promise that I will number my answers on the exam, all right? The reason for this is it's really gonna help you to make sure that you're not writing more than the recommended, how many they're asking for. And on the flip side, you're not writing less. So some of the questions really do ask for a lot. Some of the questions in the example that the Alliance puts out for their practice stations, they ask for 6 things. If you're in the groove of doing, 3, list 3, and then there's a 6, I really want you to make sure that you're numbering all of those, okay? Everyone put their right hand down. Okay, next, spelling does not count. but they must understand your response in order to mark your response. Again, that's what the Alliance says. What I say is, if you don't know how to spell it, pick a different word, okay? You should know how to spell everything that you're putting down there. Even dysdiadochokinesia, you should know how to spell that. So a good written station answer can save your performance in the clinical part of the station. So don't give up if you feel like you messed up the practical component. Again, I've talked about this point 3 times now, and we're only 15 minutes in. But really, really important, you guys, don't let a poor performance go forward with you. You need to have that skill of perseverance, shake it off, move on. It's okay if you don't pass every station, okay? And really, these written stations can save you from a poor practical performance. So make sure you know how to do these. All right. Last, we do suggest that you keep notes of important information during the station. So I actually really worry in telling some of you this point because technically you should be able to remember everything that happened 5 minutes ago. But if there's something crucial, like a diagnosis or key information the patient's telling you, you can write this down in your booklet. I personally chose not to write anything down when I did my exam, but it's a suggestion that we do give to our students who are quite anxious or tend to forget those key information. So take that point kind of as you will. Again, I didn't do it, but if you feel like you do need to write things down, potentially, questions that they're answering, or say you're doing a manual muscle test and you think they're grade 4 and it's a certain muscle, then definitely do write those points down. Okay, now let's talk about what type of questions you need to be preparing for. So what will they ask you in the written section? There are definite themes that come up in these questions. So what I've done is I've gone and created a list of potential questions that I think are probably going to be asked, okay? So we're going to go through each of them. So the first one is list goals of treatment. So what I'm saying here is that you're going to have a clinical interaction, and these questions are very likely to be in those written stations, okay? So list goals of treatment, list contraindications or precautions, or even safety concerns, so things that you just want to think about in a station. List long-term and short-term goals, state outcome measures you might use, how would you progress or regress treatment. You sometimes need to remember your findings, okay, or state a new clinical impression or physiotherapy diagnosis. So if you guys have, your iPhone on you, take a screenshot of this if you want. I'll send it out to you guys in an email afterwards. I'm also going to send you all a little worksheet that I made up, and I put in 4 scenarios there. Now, you guys can easily make more scenarios, but what I want you to do is go through each of those scenarios and make a list of these answers to them, okay? I'll explain that a little bit more in a bit, but just know that you guys are going to see these again, okay? So now I'd like to go through each of them. So I have gone through on the website and taken the Alliance's clinical component practice questions, and that's where I kind of came up with these lists for you guys. I'm also going to show you examples of each of them. So for example, in this one, we're looking at the list goals of treatment. Okay. In this example from the Alliance, they've asked you to list 3 goals of treatment with respect to the patient who has osteoporosis. This is a great question because it is a clinical application of your knowledge and it's pathology specific. So the other thing I want you to notice here is you'll see that it's saying list 3 goals, but each correct answer is with 2 marks for a total of 6 marks. Okay. So remember, it only says list 3. So you're only going to list 3. This is just showing you that there are lots of potential answers for a maximum possible score of 6. Okay, so I don't want any of you guys to get confused with that. All right. Sorry, I'm just seeing a few of you guys have some questions that you're putting down here. I'm going to go over your questions at the end because a lot of these right now I feel like I'm going to answer. All right, so hopefully that makes sense for list goals of treatment. Next, we're going to talk about listing contraindications, precautions, and safety concerns. So these are great questions to ask because in these type of stations, the question is asking you potentially about a clinical interaction, or you're doing a clinical interaction, and then the follow-up question is asking about contraindications. So describe 3 precautions and or contraindications related to this tube. And in this question, they're talking about a chest tube, okay? So you'll find here, I find this a little bit interesting because the first 3 are main answers. So what I mean by main answers is they're ones that you guys would all know, right? Don't put traction on the tube, don't lift it above the incision, don't compress, kink, occlude the clamp, right? Those are all ones that I think you guys would know. But what I want you to look at is some of the ones below that. So don't disconnect the chest tube, don't tip the vac, don't do percussions over the tube. So a little bit more obscure, okay? So the reason why I want to bring your attention to these is because if you are stumped and you can only think of, say, one of the 3 that it's asking for, make sure you write something down, okay? You never know what they have on their potential answer list. So please make sure, again, if it asks for 3, just write down 3. Think of something, even if it's as much as don't cause pain around the incision site. You know, write something down. You never know what they're going to accept. All right. Then next is list long-term and short-term goals. So I want to share this one with you because their answers here work for so many pathologies. So in this question, they're talking about a patient with ankylosing spondylitis. However, many of these answers work no matter what the pathology is. All right, so let's take a look. So again, this is dealing with ankylosing spondylitis, but if we maybe changed it to a patient that was maybe post-MVA, Parkinson's, or post-ankle fracture, we can see here that a lot of them would still work. So increase or maintain strength, yep, that would work for MVA, Parkinson's, post-ankle fracture. Maximize or maintain posture, yep. Maximize or maintain function or functional adaptation, super vague, you guys. These are really, really good to have in that database so that you know these will work. Decrease pain, and education about energy conservation. So I've highlighted these ones for you because I really do want you to kind of have this in your back pocket of really good long or short-term goals that work pretty much for any pathology, okay? Other thing I want to draw your attention to is you can see in this that it's asking for 6 goals of long-term management for this client. However, the maximum possible score for the station is 7. Now, I've reached out to the Alliance to say, you know, is this simply a calculation error, or, you know, is it really possible to get 7 marks on a station that's asking for 6 goals? Of course, I did not hear anything back, but what I do think is important to take from this is the first goal for ankylosing spondylitis is maximize or maintain chest expansion. So this, of course, is one of the most fundamental goals that we need to work with this patient, right? Because once they do start to get into that chest restriction, they can get into that not obstructive, but they can get into more of that, you know, structural restriction on breathing, right? So it's kind of like a fibrosis that they're experiencing, and that ultimately can lead to them not being able to breathe. So maximizing or maintaining chest expansion is super important, and potentially that's why they gave it 2 points. Okay, so it looks like there maybe is the potential to get an extra point if it's a very accurate written response. Again, it could totally just be a calculation error, but I'm speculating and I wanted to pass along my speculation to you. All right, let's look at the next one. So state outcome measures you use. So this one's pretty self-explanatory. Hopefully, while preparing for the written, you prepared a good cheat sheet of outcomes measures for each pathology, but this would be a really good time to review that sheet. So I see a lot of you guys asking some questions about outcome measures, so this is where that would come in, okay? So again, in that handout that I'm gonna send to you guys afterwards, we list these things like outcome measures. I want you to think about those for these different scenarios I'm gonna show you, because it's really, really important for you guys to have a solid list of outcome measures. Okay, again, if you had a good cheat sheet, if you're in one of our courses, go to the manual. We have this cheat sheet pre-made for you, and just re-look over those outcome measures. All righty. So how would you progress a regress treatment? All right, I'm going to get you guys to help me out a little bit with this one. So I know many of you guys have joined me before, and we had a whole webinar on exercise progressions and regressions. But the written section is a really wonderful place to test that as well. So how would you regress or progress a certain exercise or a certain treatment? So we're going to talk about this one. So the client returns for a second visit post fourth MCP fracture, reporting increased swelling and pain in his finger. So list 6 options you might add to your treatment. Right? So what would you do in this case? If this patient is now reporting swelling and pain in their finger, what would you add to your treatment? I want to see how many of these you guys can get. So remember, it says 6. So for all of you that are rating 1 at a time, I want you to rate 6 in there. I see a few of you writing in price. For your own sanity on this exam, break that down. That's 5 right there. Okay, so it looks like we have a lot of responses. A ton of you guys are only doing 2 or 3. Again, I'm seeing a lot of you guys write price. Please write all of them out. Don't just write price. It's saying 6. Get some points. Okay, let's look what it says. So the client returns for a second visit using reporting increased swelling with 6 options you might add to your treatment. So contrast fast is 1, whirlpool, elevation, ice, compression. So again, guys, price, look at, we don't have necessarily protection, although it definitely could be there. But we have, that rest, we have elevation, we have compression, we have ice. So please don't write price, write it actually out. Yeah, we have rest there. So really make sure you get all those points. Don't use price, okay? Awesome. So let's keep going then. There are some stations that may require you to remember your findings, okay? So here is a good example of a station that's like that. So in this station, there's a client who has a C6 spinal cord injury, and you've been asked to evaluate the strength, okay? So the big thing here is that you'll see that they're gone in and they're saying, okay, well, the biceps are grade 4, brachialis grade 3, brachioradialis grade 3. So remember, these are actors, so they're going to be acting this out. They're not actually going to have this, all right? So it's really important that you guys either remember those, they're going to make it obvious, so it's not going to be hard, or you do go and write it down, okay? So my tip here is if you notice an unusual objective or subjective finding, so something that's not normal in a 5x5 station, write it down or just make sure you remember it, okay? It will likely come back to play in a written follow-up. So just kind of make a little highlight in your brain when that situation happens. The next point here is state a new clinical impression or physiotherapy diagnosis. So another example of this is 6 weeks later, your patient comes back, they have swelling and pain in their hand and their wrist is shiny, all right? So, and the range of motion has decreased. So what is likely their issue? This could be a follow-up question for so many pathologies, but I wanted to make sure I highlighted it for you today, all right? And the reason for that is, again, they could progress an injury and they could make it have, different signs or symptoms, and you may have to state your new clinical impression or physiotherapy diagnosis. Complex regional pain syndrome is a really easy one to progress, so this is a good one to know. And again, I would choose out of all these, the shoulder hand syndrome or reflex or RSD, I would go with CRPS. That's the new way, that's what McGee teaches, and that's what the Alliance goes off of. This answer key was made up a long time ago, so I really would encourage you to do complex regional pain syndrome. I think if there were more marks to be given for some answers, that's one that I would probably think you get more marks for. All right, so let's go back. Remember here, we have that list of potential written stations that I want you guys to look at, okay? The top 4 are super important because I feel like they apply to many different pathologies. So for example, if you had a patient that was an NBA, you could list goals of treatment, you could list out contraindications or precautions, you could do all these things ahead of time so that when you go into the exam, you've already prepared and planned. So I have a bit of homework for you. The first 4 questions are ones, again, that I feel like you can prepare for multiple pathologies in advance, so I'm going to send you a handout to work on. I'm going to send it to you after in an email. And then what I want you to do is go through them. And I want you to even think of more scenarios for yourself, okay? Share them with friends, see if you guys come up with the same things, brainstorm if you're not feeling like you're getting enough, but use each other and use this as your cheat sheet so that you've done all the thinking and that hopefully when these come up in the exam, perfect, you've already done it. All right, so I'd like to do a station to review everything that we've gone over today, all right? So what I'm going to do here is I'm going to give you 1 minute to write down on a piece of paper what you would do in this station, okay? So it's a 5 by 5 minute station. What I'm looking for here is how you would organize the station. Not necessarily, exactly what you're going to do, but I do want to see how you would organize it. So I'm going to give you 1 minute, and here we go. All right, so that was 1 minute. So now what I want you guys to do is I want you to think about, or I know you've been thinking about, the 3 testing positions, all right? So we have 3 testing positions. We have 1, which would be standing, 1 in sitting, and 1 in lying, okay? So I want you to tell me all the tests that you would do in standing. That's 1. Awesome. Okay. Now I want you to tell me everything that you would do in sitting. Yeah, and you can get a little bit creative in sitting. Some people like to do some myotome testing for L2 to L5 in sitting. Some people like to do it lying, but that works, okay? And what would you do in lying? So I know you guys can't see each other's responses, but that's okay because I'm going to show you the answers in the next slide. But what I'm looking for is to see if any of you would get the little trick in this question. 1 person so far, I see. And thank goodness they're in our course. Okay, a few of you guys are getting it. But let's go over what I'm looking for. So what I'm looking for here is I want to see how would you organize this. So in standing, I would test S1. In supine, I would test L1 to L5. And I would test Clonus and Babinski. I'm taking a big pause there because I really want you guys to make sure that you're getting this because very few of you, good job, Teresa. You got this. But I really want to make sure it said, remember the question said, that you're testing reflexes, so you need to check those long track reflexes, and those are going to be your Clonus and Babinski, okay? And then in sitting, you could do your patellar and Achilles reflex. Now, again, the supine and sitting, you can mix those together a little bit, but I just want to make sure that you guys are thinking here and that you have a really organized way of doing this. I see a few questions about the L1 myotome. I always say L1, L2 for hip flexion, so whatever works for you. All right, so I hope this really drives home a point to you guys that the station is not that difficult, but what we're looking for is a kind of a trick situation here. We're saying reflexes. A lot of you guys didn't say that Babinski and Clonus. So that's one little trick you guys need to make sure that when you're doing these 5 minute stations that you're aware that there's usually something that you just need to pay a little extra attention to. But for the most part, the stations are fairly easy. okay? So you're gonna get more marks if you got this patient standing, then supine, then sitting, rather than going through all the myotomes and then getting them back into standing and then back into sitting to do the patellar and Achilles reflex and then back into lying to clonus Kempinski. You're not gonna get full marks for that, okay? Next, we're gonna do the written scenario, okay? So you have 5 minutes to do this. Now again, guys, I always go over. But what I'm gonna do is I'm gonna put everyone's hand down, and once you're done the scenario, please put your hand up. Once I see the majority of you guys put your hand up, we're gonna go through the station, okay? So here you go. Okay, I see lots of you guys starting to put your hands up, but we're still gonna give you 1 more minute, okay? Alrighty, so let's take a look. Still, a lot of you guys haven't put your hands up yet, so I'm trying to give you guys a bit more time. But I do want to go over this with you guys. So let's take a look at these answers that we're getting. So first off, list 2 subjective outcome measures you could use to monitor this client's progress. So let's get you guys to type in what you did for that. So here's the tough one, and I'm seeing some of you guys do this and some not. So this is being a little bit tricky here, and it's asking for 2 subjective outcome measures. It's not asking for objective. So what's an example of an objective measure? Type it in the box. So remember, objective is something, it's a sign, it's something that you can see, okay? So things that we're looking for would be like range of motion, goniometry, manual muscle testing, So all things that are not reported, they're things that you can see, all right? So versus subjective are things that they report. So answers that should be correct for this are things like the numerical pain rating scale, which is good. A lot of you guys did that. Roland Morris, outcome measure. We could do things like just ask them, we said that. We said the pain scale. But really any of those, quality of life, the NPRS, any of those scales, LEAST is another really good one. And you definitely can say visual analog scale for pain rating. So what I'm wanting you guys to understand here is the difference between a subjective outcome measure and an objective outcome measure, okay? So make sure you're paying attention to that on the exam. Next, the client has more pain with extension than flexion. Okay, list 4 at-home exercises you would prescribe. So I really hope you guys got this. If you follow us on Instagram, you will have seen that we have a ton of exercises that we've been posting last week for flexion, extension, and stability exercises. So let's see what you guys are coming up with here. So this patient has more pain with flexion than extension, or more extension than with flexion. So you're going to give them some flexion-based exercises, right? So good, knee to chest, unilateral, bilateral, single knee to chest, bent knee fallouts, pelvic tilts, forward bending, roll downs, child's pose. Okay. Awesome. You guys are really getting it. So I'm happy to see this. A few of you guys have commented which outcome measures. There's a lot that you guys can do. Just remember that they're subjective. So the main ones that I would do for this is I would probably do something like the visual analog scale. The other one that I would do for subjective would maybe do something like, sorry, I'm just going to my notes. I would do something like the quality of life scale, or I would do LEAST, Roland Morris, really trying to use those subjective findings, okay? Last, 1 week later, your patient returns with signs and symptoms of Katelyn syndrome, okay? What signs and symptoms would be present? So I hope that I can kind of answer a few of your guys' questions about this. So a lot of you guys were asking, in this scenario, should you be clearing contraindications? So no, the question is not asking for you to clear contraindications or do a subjective assessment. It's giving you what it wants you to do. And really, I hope that you take that home from today, is that these 5x5 stations aren't trying to get you to do a ton of things. They're really going to lay out what they want you to do, okay? So what are signs and symptoms that would be present with Katelyn syndrome? You guys should know this. Saddle paresthesia, bilateral numbness, tingling. What else? Trying to see if someone's going to get it. Good, yeah, loss of bowel or bladder control. Perfect. So those are really what we're looking for, okay? So I hope that really helps you go through that station. Again, if we look back at our themes that we picked apart, it's saying, outcome measures. We're saying, how would you give them exercises? And then we're saying, what might be present in a progression or regression of this pathology, okay? So one thing that someone brought to my attention, which I totally made a mistake on, is I did not include S2 in this. So remember S2, knee flexion or eversion, just make sure that you, again, just put it in that organized position. Maybe you might want to do it in prone, and so a good place to maybe put that in would be after supine, but I definitely missed putting S2 in, so thank you so much. All right, so go for the last few things here, guys. I have 1 minute more left with you. So tips before the exam. Okay. So try to get some exercise before the exam starts, guys. Please. And ensure that you eat so that you give your body and your brain the fuel it requires for this exam. It's a long day, so stay hydrated, and being fueled is key, all right? Leave your notes and textbooks at home. This is another time where I would like to ask all of you to please raise your hand and repeat after me. I will not bring my notes to the exam, okay? What you know, you know. And really, there's nothing more you're going to learn the few kind of minutes or hours before the exam. Relax, rest. Again, this is a clinical exam. They want to see what your interactions are like, so clear your head, okay? Research has shown that studying on the way to the exam is likely to muddle the material you have just mastered, so you're going to impair your exam performance. So please do not bring your notes with you. Trust in what you've done so far, all right? Make sure you know how to get to the exam. practice getting there. Maybe try to go a little bit early. For those of you who, I know a lot of you guys are UBC students here, you obviously know how to get there, but if you haven't been to this place before, arrive early. I don't encourage you to arrive an hour or 2 hours early. 30 minutes is well enough early, okay? If you want to sit in the parking lot, then fine, but try not to go too much earlier, okay? You don't want to feel rushed, but you also don't want to feel stressed that you have all this time to pass, okay? Now, I usually say go inside 10 minutes early. Don't go inside earlier than that. If you're someone who, gets really nervous being around other people, just find a quiet coffee shop, sit in your car. Don't go in into that last 10 minutes. You're there, you're there, but just don't go around all those other people. I really also would like you to sit alone before the exam starts. Now, I realize that I'm potentially making you guys all be these kind of social isolates before you go into your exam, but really get into the zone, get inside your head and think about, just breathing, whatever exercises that you know how to do to calm yourself down. And if you're the type of person who does really well with being social and talking to people, then, do that. But these are just kind of those tips that generally work for a lot of people, okay? If the concern, so going back to avoiding having other candidates quiz you, and the reason why I say this is because if the concerns of other candidates, they're saying, oh, but what about this, it's likely going to upset you. So really do find a place to just sit and relax. On the other hand, if chatting and being with friends, as I said, is your comfort, steer conversations to non-exam topics if possible, okay? I really hope in these next few days that you guys really do hone in on some of your favorite relaxation techniques, okay? Try to do this before, and it's something that you can draw on throughout the exam, whether it be something like tapping or deep breathing or visualization. Use those techniques, okay? And the last one, and I'm putting this last because I want you to make sure that you do this, is go to the washroom, okay? It's really, really important because it's a long exam. Okay, what are you going to bring with you? Please remember this. You need to bring, or you will have received a booking confirmation email from the Alliance about 7 weeks in advance of your date. You must bring a printed copy of the booking confirmation email with you to the exam, okay? Otherwise, you will not be granted access. So any electronic copies will not be accepted. So an email copy or a cell phone, that won't work. It needs to be a printed copy, so make sure that you bring that. Next is one of 3 government-issued IDs, whether with a signature, so a driver's license, a passport, or a permanent resident card, okay? So make sure that you bring that. Next, there's any medication or other supplies that you have permission to bring. So you need to have been approved for special needs plan from the Alliance to bring medications or other supplies. But if you did already do that, just make sure that you bring it. And then last, you need to bring a lab coat and a stethoscope. All other required equipment will be provided, okay? So, last few things here, guys. I'm almost done. For those of you who are not writing, just want to let you know that we do have some courses posted in Vancouver, Calgary, Ottawa, and Toronto for next year. All right, everything's already been posted. We have a free practical review day that I recognize a lot of you guys from here. And really what this is just a chance for us to get to meet you. We have a 2-hour session where we just go over important content, and we're going to pick our cities that we're going to probably in the next week or so. So how you vote for your city is you just go to the link in the email that I'm going to send you. So right now, Calgary and Toronto are winning. We have about 30 students registered for each of those. So I encourage you guys, if you are from, Toronto or Calgary, push it up either way. Yeah, Edmonton and Vancouver are the next 2 there. But anyways, coming up next, we are shifting our focus a little bit to more of the written exam. We know the written exam is coming up really soon on the 26th. So we're going to have a practice written mock exam. And then we're going to go over some anatomy for people who are starting to study for the June practical exam, and definitely for the written. Okay, so last poll I'm going to post on your screen here, okay? And it's a little bit cheeky, but what are you going to do when the results come out? Every single one of them says, please email me and let me know how you did. I really, really honestly mean this, you guys. I feel like, I'm a little bit new to doing these webinars, but I've had an amazing turnout from you guys. I've had such a good time getting to know so many of you guys through these webinars, and I really am so invested in how you do. Of course, if you're in our class, in our course, I'm going to bug you until you get back to us. But even if you're not in our courses, I would just love to know how how you did on the exam. Okay, of course, don't tell me anything about the exam. I just really want to know how it went for you, and of course, if you passed or didn't, and if you passed, I want to know that you're part of this awesome profession that we all get to share as being a physio. It's an amazing, amazing profession. So otherwise, you guys, you can subscribe to our YouTube channel and you'll get notified when this recording is ready. I'm going to do my absolute best. I'm going to stay up as long as I need to tonight to try to get it ready so that it's posted for you guys tomorrow so that you have it. Last but not least, good luck, okay? I know a lot of you guys here are taking the exam. Sorry, I don't want to share those results. You don't care. You don't care that everyone said that they're going to email me. But yeah, I just want to say to you guys, good luck. Breathe, use those relaxation techniques, be confident in all the work that you've done. I know there are so many PT exam prep students here, whether it's in our full course or the practical crash course, but I really believe in the program, and I really believe that you guys have the skills to be able to do this, okay? So I see so many of you guys that I know, and I'm really, really excited for you. So Shelly, good luck. Kirsten, good luck. Mukinder, good luck. Okay, Tina, good luck. Just a few names that I'm seeing in there. Suchi, good luck. Thomas, good luck. Tintin, good luck. You guys got this, okay? So I'm going to answer a few questions here.